the medications
so what
that
you're
will
saying,
bring.
this is not a lasting solution. You know,
Well,
identifying problems that could even trigger fear. You may have BP at my age. How do I take care of this? Oh, you may have this. How do I manage this? So with that note,
no, we want to change the mentality of thinking like that.
Okay.
Because if you look at the advanced world, like United States, Canada, and the rest, the reason why people last longer is the fact that they identify what their problem is,
that's where I want
and then
to
they
come
start
to.
managing that problem.
Okay.
Once you identify a problem and you start managing it, your lifestyle, your life, your lifespan and everything is better, is longer. So if you know that you are diabetic, and assuming every day, morning, afternoon, evening, when you eat, you have a can of orange juice, and you now get the teaching, the instruction that orange juice is bad for someone that is diabetic, especially concentrated orange juice, what do? You now switch orange juice for water. Do you know you've just lengthened your lifespan?
Okay.
So those are the things we're going to do, like we say sex education, erectile dysfunction for men, self breast examination for women. If a woman is examining herself maybe once or twice a month after taking warm bath and knows the contour of her breast, when the lump starts developing, that woman is going to know first before even going to the doctor. Then when the doctor now see if it is early enough, the lump might just be taken away, which is a seed. But assuming that medical mission, they didn't teach that woman how to do that. By the time she find out, it will be as big as an apple. Then it has metastasized, gone everywhere. So that is the difference between medical mission and actually, doing a lasting treatment.
Okay. Mercy Grant, can you just, for the purpose of clarity, what are some of the cases you are going to be taking care of?
We will take care of diabetes.
Okay.
High blood pressure.
Okay.
Like I said, our very passionate aspect, wound. Do you know we have a lot of natural things here that can take care of wound and cure your wound? There is a medication called Medihoney. That Medihoney, just a tube over there, is up to $300. And we have our natural honey here that we are going to teach our people. We'll mix it together, keep with them, and say, this is what you do once you wash it every morning. As I'm going to teach you what to do, we'll leave them an instruction and say, this is what we do. Take care of this this wound. And even for a fungi, we were looking at a case we treated. This patient used all kind of medication, and my wound care specialist said, use honey. She told him the kind of honey to use. After 2 weeks, it was clean and clear.
Wow.
Yes. So these are the things, these are the areas that we are going to be focusing on. Sex education, health awareness. Just like my president said, a woman, after your warm bath, just massage yourself, massage your breast. You will feel the lump first before anybody. If not, before you know it, oh, maybe I'm feeling pain here. Oh, no, you know your body. You always know something is wrong, but we always ignore that thing that is wrong. With us, oh, it will pass away, it will pass away. It can be early detection. That is what America also teaches us. Even as we are here, we do it on ourselves. Early detection. Even a man can feel his prostate and see, okay, come on now, this lump wasn't there before. It might just be, just an empty fear. But once they go and check it, it's like, okay, I don't have anything there. I don't have anything growing. You don't have to wait until, but if you don't know, you don't know what to check for. My president printed out a lot of teaching on erectile dysfunction. Not everything requires Viagra.
Okay.
Your food alone, the kind of food you put together to eat, exercise, helps the blood flow. Instead of a little thing, oh, let me go get Viagra, and then you will take Viagra and you have high blood pressure. Before you know it,
You just pass.
yes. But just diet, certain food that we put together that we have everywhere, and it's very accessible to people. Very cheap. You eat this and watch what happens. So we are bringing this awareness out to the people. this is what we learned over there, and we are bringing it here.
Okay.
And then these are all the aspects that we are covering this time, and then we will monitor the progress of the people that we came to see.
Okay. Okay, Dr. Edison, there are some cases that will come up. Some will require surgery. So how do you handle this? Have you prepared yourself that? Because surgery is not just going to be like detecting, okay, I know you have this. How will the person take care of this? What have you planned to do for those cases that will require surgery?
Just like I said, the medical mission is to assess the patient and advise and give instruction on how to get better. But if the care gets higher than that, the follow-up doctor, the local doctor, will now take care of that, because surgical procedure is a different ball game. We are actually working with a team now that is going to come for thoracic, cardiothoracic surgeon, but it's just going to be on children. But we're working on that. That is different from this. But for us here, we are here for health promotion, disease prevention, detecting of any little ailment, like, hypertension, diabetes, but we also came with some glasses. We're going to have a dentist, we're going to have optometrist that will just, do some kind of assessment and make your sight a little bit better with the reading glasses
so
installed.
You are not ready for surgery?
But there is no surgical procedure, because if we were going to come for surgery, that would require what you talked about before, bringing heavy equipment.
Right.
Now, liaising with a hospital that have the adequate environment, which is the theater. But that is a different ballgame. No, there is no surgical procedure, no surgery at this point. What we're doing is teaching, making you aware, just like the chair said, of what to do. If I go back to what she just talked about, like erectile dysfunction, there are exercises that you can do, that I can just explain in a few seconds, which we call, the Kegel maneuver, where people just hold their urination. If you are urinating now, or you are having a bowel movement, and someone say, hey, Mama Manuel, you will hold it and say, hey, how are you?
Okay.
That is Kegel exercise. If you do that, you count, you are still breathing up to 10. You've done 1. Relax. If you do 20 of that a day, you are actually improving the blood flow to the peri area. Because the only reason why men have erection is because blood flows to the peri area. That is what makes your erection stand. But when we talk of erectile dysfunction, we have different categories. You can have an erection, you go into your spouse or a woman, and then you hit maybe 2-3 times and he's dead, or he's going down. That is part of erection. Some don't even get up. If it's organic, exercise won't help. But the one that it doesn't stay, or it doesn't stay long enough, those you can do exercise. Aerobic exercise also improve blood flow. It gives you, cardiovascular, you are okay. There are also food that you can eat that improves that. We have watermelon being sold all over the place. Watermelon, according to statistics, is about 95% water, but 5% of it is almost like Viagra. It has exact same content as Viagra. You have that, you have apple, you have green vegetable. So what people do in the United States, they will take like watermelon, take apple. There is beets. I'm sure it's all over here in Benin. I've seen it in the fruit market. Also, beets has a high content of nitric acid, or what is needed to really give you good functioning penis. If I may put it that way. So people will take like beets, watermelon, apple, strawberries, and blend them together and just drink it. It may not taste too good, but you drink it, you exercise, you do this Kegel exercise that I'm talking about, the men will see an improvement in their erection.
So it's really not about money, getting money to go to the hospital.
No.
It's not really what you should really panic about.
Like I'm sitting down here now, and I hold my urination, and I tighten my anus, muscle. I relax. Did I pay anyone?
No.
No. Those are the kind of things we're going to teach. A woman taking hot shower, and then the breast, and she does this all the way to the tip of the breast. Oh, and say, okay, everything is smooth. It doesn't cost any money. Let's say once a month, but you can do it more often. But if you did it like this and there was nothing, and a month from today, and you massage your breast, you say, my goodness, what is this? It's time to call your doctor.
Okay.
They may do a mammogram or CT scan or whatever and say, oh, no, there is a little thing. It's going to grow. We are not saying it's cancer, but they have different stages of cancer. Or they have different stages of lump. And say, madam, what I will advise you is to take it out. If we don't take it out, it's going to spread. You take it out. That may have saved your life. Statistically, if a woman have breast cancer, it's going to go down to the daughter, and from the daughter to the granddaughter. So that is why you see in the United States or advanced world, if I am a woman, my mother had breast cancer, some women will just opt before they turn 15, 17, take it off, because they know it's going to happen. It's hereditary. They'll take it off, put like implants and stuff like that. But I'm not saying that women should go do that. But what we are preaching here is that the teaching that we do now, sex education. Of course, who wants to enjoy for 5 minutes and then throw away your life? There is condom. Use condom. You still have the same enjoyment. There are different categories of condoms that you want to use, so that you can derive that enjoyment. So those little things, disease prevention. We go around here, someone go and throw away snuff and everything, and then just do hand like that and come and prepare your food. Do you know that they've just transmitted what they have into your food? And you eat it, then you have food poisoning. So there are little things, washing of hands.
This is really education,
And now, when I scrutinize scrupulously the way that our medical care is carried out, I sat in an office and I saw my friend that have a practice wear gloves, take care of one patient, go to another patient. No, it's not like that. In the advanced world, once you wear that glove you take care of one patient, you take it and throw it away. Otherwise, if she has psoriasis or some kind of skin disease and I touched her and I do that and I go meet another, I just passed it on. Or you see someone is coughing and coughing, everything is going and hacking cough, right? And you see, oh, it's my brother or beg. Well, you are actually inhaling what that person. Then the next 2 days you are the one coughing. So there are little teachings that we're going to do, and it's going to be a part of this medical mission.
Okay. So this is really educative, it's inciting. So how long will this last? Starting from when? Because I know Edo people are waiting. They are watching. So from when will this treatment commence?
Starting from today.
Okay.
We'll end up on the 18th.
Okay.
Yes.
From today to 18th of February?
Of February, yes.
Okay. So what age brackets do you intend to take care of?
We don't have any limit. We have medications for children. We have medication for even 100 years old. We, just like we said earlier on, we're going to be in Benin today.
Okay.
When we leave Benin, we're going to Uga and Ebohua tomorrow.
Okay.
Then the day after, we will be in Igobazowa and Uhen. The day after, we will be in Uromi and Ebohimi. Now, we won't come back to Benin because you know the distance.
Okay.
Because from there, we're going to Okbila and Fuga the next day. And they are all getting ready for us. The community is being wired up and they're waiting for us. So we'll be there those 2 days. Then, when we're done, we will come back to Benin on Saturday.
Okay.
Who knows? I promise these guys and all the doctors, we have few of them here. That is a doctor right there. That is one of our movers and shakers there, Mr. Blassen, who also, is taking us to his village tomorrow. So we have doctors and everything that we promised and brought from the United States and Canada.
Okay.
If I am able, the chair is able to convince them, who knows, we may do 1 or 2 things Saturday, Sunday, next week, but we don't know yet. But I promise you, as this get bigger, next year we're going to have more locations because we are having people interested now. We are encouraging those on ground. We want the doctors, we want the medical personnel, we want the nursing schools and medical school to join us. This is not something we are getting anything from. We want to spread the spirit of volunteerism so that even when we are not here, doctors themselves here can organize and do one. And that is the goal that we are looking forward to.
Messi Grant, when you were mentioning cases that will be taken care of, you did not mention HIV/AIDS. I know the doctor said, I said, Doctor, Mr. Edison mentioned that when you see someone coughing, because you're a relative, you want to take care of the person. So is it that you are not going to be talking about that case? We're not going to treat such cases?
We will.
Okay.
We actually have test kits.
Okay.
To test for HIV/AIDS for people. Like what we cannot do in America, we will not do it here.
Okay.
In order to test you for that, we have to get your consent. If they give us the consent to test them for it, we will do it. And if they are positive, the good thing about it is HIV/AIDS medication, tuberculosis medication, these cases are known as epidemic, and they don't pay for it. The World Health Organization send the medication, will refer them to the appropriate health center for them to be getting their monthly medication. And of course, they will get it monthly, their antiviral medication. And we will follow up on these patients to make sure, because in America, if you are tested, they will follow you up. It is also your duty to go there and get your medication. Okay. So we have these things in place. And then another thing we didn't mention, Mr. President, is there is a machine. It's called A1C machine. It's before we even do a finger stick. This, if we will use that machine, it will detect if you have diabetes right away. And then we will know what to do, because a lot of our diabetic, they don't even take their medication anymore, but diet. Just like my president said, when you have a concentrated orange juice, you hyping your sugar up. What time do you eat your carbohydrates? What are the food food you eat? What time do you eat this food? A lot of people go along with illnesses like this, and then the doctor will wean them off the medication.